Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the lupus nephritis, there are some features which will increase the risk or which will cause high progression of disease in lupus nephritis. So, what are they? So, in the systemic lupus erythematosus, so what are the factors which are associated with, or we can say, poor prognostic factors? That is, actually we can tell that these are the poor prognostic factors in lupus nephritis. Okay, so actually these poor prognostic factors will these are actually high risk factors for progression of the renal disease also. So for renal progression also they are high risk disease and they are also poor prognostic factors. These include hypertension. We have hypocomplementemia can result in rapid progression if the patient has high anti double stranded DNA antibody titers, if the patient is a pregnant woman pregnancy, or if the patient has nephritic urinary sediment is seen, or if the patient has azotemia, or if the patient has less platelets, that is thrombocytopenia is present, or if the patient has proteinuria, or if there is decreased glomerular filtration rate. So high risk factors in renal progression include hypertension, hypocomplementemia, high anti double stranded DNA antibody titers, pregnancy, nephritic urinary sediment, azotemia, thrombocytopenia, proteinuria, and decreased glomerular filtration rate. All these will cause progression of the disease in lupus nephritis.
thank you and thank you for watching.